I want to talk about this, which seems to be quite a significant initiative. It's a new health clinic that's opened at one of Orange Farm's busiest taxi ranks, and it brings critical medical services directly to taxi drivers. It's an initiative launched during Men's Health Month, and it's a partnership between Rhiza, the Department of Health, and the local taxi association. And the whole aim is to take away some of the barriers to healthcare access for drivers who often can't afford to take time off. And we're joined in our studio by Monty Motsopa, who is the spokesperson for the Orange Farm United Taxi Association, and Alef Meulenberg, who is the CEO of Rhiza Holdings, about why this program matters and the impact it is expected to make. To the pair of you, thank you very much for being with us. Really do appreciate your time. And Monty, maybe let's just start with you. You create a solution out of a problem, or for a problem that already exists. So talk to us about what taxi drivers are experiencing, what their challenges are in accessing healthcare, and why this program was needed in the first place.
As you just said, Iman, we created a solution because what we wanted to do is to make life easier for our drivers, because they wake up early in the morning. They don't have time to go to the clinics.
When you say early in the morning, so really take us into that. I mean, how early are they getting up? How long are their days?
Hey, they wake up early at around 4 o'clock. They have to be at the rank because our first taxi leave the rank at 4:30. So they don't have time to go to the clinic. Since we are having this clinic in our rank, they will have an access to go and take their medication so that they can live a good life. That's why we decided to bring the clinic right into the taxi rank.
So when you say they start at 4:30, I mean, what time are they knocking off?
Hey, they knock very late. It depends on how busy it is. Sometimes they knock off at about 7, 8 o'clock.
Sure.
They knock off very late.
That's a long day. Alef, and understandably, where would the time be, even for a lunch break, let alone to actually go and consult a clinic? So talk to us from your perspective how this initiative and this partnership came about, and who else is partnering to make sure that it is a success and meets the exact needs of these taxi drivers.
Thank you for having me on the show, Iman. For us, we really care about universal access to healthcare. And the group of people that didn't have universal access to healthcare were taxi drivers. So we've been in the community of Orange Farm for a long time, over 10 years. And this came about with communicating with the community and with the taxi association. And by doing so, this need was addressed to us with the request of building a clinic for taxi drivers specifically. It is for the community at large, but the main focus is to ensure that those who are transporting the majority of the South African population, to ensure that they have access to quality healthcare and that they don't have to wait long. So our clinics are designed to ensure that whenever a patient comes through, that the maximum waiting time is 30 minutes. And that's much faster than what public clinics can do. And that's mainly because there's a small fee associated to it, but also we hire nurses that have that type of mentality to ensure that people get very, very high quality care, but that the waiting time is very limited.
Yeah, Alef, I mean, it brings to mind, Monty, the concept of a pit stop. You're quickly in and you're quickly out. But what specific health challenges, Monty, can you share with us, do taxi drivers typically face? And how is this empathy clinic designed to address these issues practically and effectively? I mean, and I know, taxi drivers, not all of us love taxi drivers, right, for what happens in traffic, but you can also appreciate that this is a highly stressful job. There's competition, you're constantly on the go, and you're also eating stuff that's probably not really nutritious. So talk to us about the health profile challenges that taxi drivers in South Africa are facing that this clinic is meant to deal with.
No, thank you again, man. No, the challenges that our taxi drivers are facing now lately, like at the moment you are in a winter season, people are catching flu, we ferry passengers, some came with various diseases. So by having a clinic in our facility, which is the rank, it will make their life easy so that they can go to the clinic, get medication as quick as they can. Because what normally is happening in the industry, we want to ferry people as quick as we can. The drivers, they always wanted to load time and again, they don't have time to rest. So during their lunchtime, they'll have an access to the clinic and get help of any medication that they need.
Yeah, Alef, I want to talk about and go back to, the practical part of it. It's right at the taxi rank, as you say, and there's nothing better than being, right at the coalface of where the need is. So it's obviously strategic. What has the response been so far from taxi drivers using the clinic? What have you observed?
Yeah, so far it's been really positive. I normally check in with the team as to what the uptake is in the first number of days, and they were already indicating that the Department of Health had requested to put a shade area because there were already about 20 to 30 patients yesterday morning. So
Wow.
the uptake is quite positive when it comes to that. I think what Monty was saying is correct, is that taxi drivers do not have time, but are in close contact with lots of people. So they are more susceptible to things like upper respiratory infections, things like pneumonia if that is not treated, or just your general cold and flus and COVID, and those kind of things are transmitted quite easily in a closed environment with lots of people. And then for us, it's also important that they start looking at healthcare from a preventative measure point of view. To say, okay, cool, can I biannually check my blood pressure, do my glucose, do my HTC kind of treatments and checks and all of those kind of things to see if I'm generally in a good state from a health point of view, to prevent these kind of diseases to happen and for them to be productive in their work.
Yeah. Alef, I'm keeping an eye on what's happening in the Eastern Cape, so I might have to go to the president in just a moment, but I want to know about the rollout to other areas, right? So is this a pilot? Is this the first phase? Are there plans to scale? What's the long-term vision?
Yeah, so this is our 11th empathy clinic and our 25th clinic in total, including mobile clinics on trucks. So it's not a new thing for us. What is completely new for us is to be this specific when it comes to a clientele. So that in that case, it is definitely a pilot. And given the initial uptake, we are very positive that this can be rolled out in other parts of the country as well, and in other parts of the city. But yeah, in that case, it is a pilot to be that niche. But from a healthcare perspective, we've been around the block a few times.
All right, Monty, I want to give you the last word on this one. So it is quite niche. It's there at the point of people's need. Just talk to us about the affordability. Alef said, there's a nominal cost, but talk to us about affordability from the taxi driver's point of view. And what are they expressing to you?
No, what they are expressing to me is that they were very happy because they told me that they thought that the government is no longer taking care of them. But since the clinic is building the rank, they are quite happy. About the rates are very cheap compared to other health facilities. These ones, they are going to afford it. And then I'm happy that is what they told us. Even on the day of the launch, on the 11th, they were happy and they said they'll support the clinic 100%.
All right. Well, we'll continue to watch, your progress in this regard. As you say, it's effective. It's been designed with taxi drivers in mind, so the design seems to be working. It's accessible. I was really blown away when Alef said 30 patients already on day one. How will this change their lives, do you think, and the lives of their commuters?
Yes, on the day of the launch, yes, there were masses of people coming to the clinic. It will change their life in a way that they will no longer have to queue in the long queues in the CHC, in the public clinics. They will just come to our rank and get all the service they need. It will just ease their life.
Yeah, Alef, I apparently do have a bit more time, so let me just ask you a closing question. It's efficacious, as you say, because it's there where people need it. It's affordable, as Monty is confirming, for people. Are you thinking of adapting this to other environments as well? I know that this project is about taxi drivers specifically, but are you adapting it to be niche in other environments as well?
100%. And for us, that is exactly where we want to play, right? It's to say, let's look at the community. Let's do an asset mapping in the community to say, where are the gaps? In this community in Orange Farm, it was very, very clear that there was a significant gap around taxi drivers. In other communities, we have identified the gaps to be healthcare for preschools. So there are definitely other opportunities for us to be providing care at. And we remain open to the communities to say, this is where we actually need you to be. This is where the kind of solution that we require. And then we can work with them to build a solution that is both efficient, but also affordable.
Alef, Meulenberg, thank you. And Monty, Motsopa, thank you very much. And good luck. We'll continue to watch this one. And it's great that people are getting care where they need it. Appreciate your time and sharing the program with us.